Thank you, everyone. What I would like to do today is really share my journey with you in terms of figuring out that I had something, how I got diagnosed, and now that I have a diagnosis, what do I do about it? I want to start, though, by adding one comment about what you've seen so far. So some of the presentations you've seen have had a title that might have implied it was lipedema. Dercums and lipedema are so similar. In fact, I've heard Dr. Herbst say in the past that the diffuse form of Dercums and the stage 2 lipedema are almost, indecipherable how similar they are, and unable to separate them. So I just want you to know that really everything you've heard up until now is applicable to you, even if the title of the presentation didn't say Dercums on it. So let's get started. I have no one's paying me any money to be here today, so there's my disclosure on that. I think there's something in this for everyone, and in particular, if you have either both Dercums and lipedema, or if you have just lipedema, I think you'll see that these diseases are very similar through the story that I tell. I actually have both. The Dercums came first, or at least the diagnosis of the Dercums came first. So you've heard a lot about it, so I'm going to go fast through some of these early slides, but keep in mind there are multiple types of Dercum's disease, and there are lots of comorbidities. These are not necessarily all proven scientifically, but from the patients who are in all the different discussion groups on Facebook, these are the disorders that show up a lot with Dercum's disease, so I just thought I'd list out some of them. There are others. There are some people who have MS. There are some people who have other autoimmune conditions along with Dercum's. Whether it's just the autoimmune connection, or whether it's that they happen to have bad luck and get two different diseases. I don't know that we know that yet. So, just a little bit about it. It is suspected to be autoimmune and inherited, which I think you've heard earlier today. It involves both the vascular and the lymphatic systems. And we heard a little bit about Ehlers-Danlos today, and actually it being more connected to lipedema, but there are some Dercum's patients with it. And I'm actually starting to think, and you'll see some evidence that I may, in fact, have that as well. It's progressive. So unfortunately, wherever you start, it does continue to move along. But it's also a spectrum disorder, and everyone doesn't start at the same place. And just because someone's older or younger than you doesn't mean they have a worse case or a better case. So we're really all on our own individual journey, and you have to keep that in mind. Sometimes it can be scary to come to a conference like this, and you talk to someone who maybe has a more advanced case, and you think, oh no, is that going to be me in 2 years? And I can tell you, I had that reaction when I went to my first conference in 2010. And there was a person younger than me on oxygen, on severe pain medications, and I thought, oh my God, is this where I'm going? And I'm here 8 years later, and I don't have any of that yet. So again, individual journeys. So I was diagnosed in 2008. I started having all kinds of symptoms, which I'll share with you, and I had the good fortune that Dr. Herbst was working on the tail end of a study, a patient study, and I was able to fly out to San Diego and see her and get diagnosed. And at that time, I actually didn't have a lot of the all-over pain that characterizes Dercum's disease. So we didn't call it Dercum's during that diagnosis. She called it lipomatosis of sort of an unknown kind, but definitely something going on with lots of lipomas. And then within about a year or two, some of the pain developed that made it more likely to assume that it was Dercum's type 2, or the term we're using now, the diffuse type. My lipedema symptoms have developed more rapidly in the last few years. I can look back at pictures and think that I probably had it all along, just didn't know that. But it has sort of picked up speed, and my legs have grown a lot more. The disproportion between the top and the bottom has gotten a lot more distinct. I want to make sure you know, though, I'm not on disability as of right now. I still work full-time. I've started 2 companies since getting diagnosed, and I work a lot of extra hours because I do everything more slowly and need a lot more breaks, but I'm still able to make a living. And I'm not on any prescription pain medications yet. So I feel very fortunate, and I don't mean to imply that that's anything I've done. That's just my journey and where I am in my situation. So unfortunately, some people have a more severe case that they may have to deal with disability and pain meds. And as I said, I've changed my career to kind of accommodate what I needed to do to stay healthy, still be able to make a living, but maybe not the same way I was making it, because I was in corporate America. I was working 14-hour days. I was traveling. The thought of even being able to get into a business suit by 8 in the morning nowadays, it's not even a consideration. So I've made it so I'm working from home. If I need to take a nap at 4 o'clock, I take a nap at 4 o'clock. If I need to put my legs up to alleviate some swelling or some backache, I can do that, and I can work at midnight if I need to. So let's talk about how we uncovered this rare disorder. First of all, I was born 2 weeks premature at only 6 pounds, and let me tell you, that was the absolute last day that I was ever underweight in my life. So I'm not going to take you through every single year of my life, but the next slide is, I kind of call it, I don't know, my slide of sadness. But I tried to, as best I can remember my weight at key points in my life, I tried to chart it and put some pictures associated with it. And what I wanted to point out on this slide is you see the early, this takes it from high school to now. And I show you college years and grad school years. I was walking around campus miles a day. I was eating a fixed amount of food because I was in a cafeteria on a plan, no snacks available to me. And I gained probably 30% of the total amount I gained at a time when I was the most active in my life. At the time, I just blamed myself. I thought I was doing something wrong. But I look back on it now and say that's probably when a lot of it kicked in, and I just didn't know, because that was the only symptom that seemed to really stand out. So, and even my dad, who was kind of always very harsh about my weight, I felt like I always maybe was a little disappointment because I was overweight. He has now said, you did not eat any more than anybody else in the family. So, so don't blame yourselves is my message from this chart, although I'm still working on that for myself. And in addition to always being overweight, and I also always weighed far more than I appeared to weigh. So it petrified me that anyone ever wanted to know my weight, because I knew I always weighed 20 or 30 pounds more than I looked like. I would hear what other people weigh and what size they wear, and I was always heavier and at a smaller size. And this kind of runs in my family. So this is my brother at 1 year old. Now, how much does a 1-year-old weigh? 25 pounds? Something like that? He weighed 50 pounds on his first birthday. And he wasn't particularly big. He's an average-sized man. He's not overweight. He does not have Dercum's disease, but he's dense. So don't tell him I said that. So he's actually a very successful doctor. He's not dense in that sense, but so let's talk about the symptoms I always had that I didn't know were symptoms until I had a diagnosis. And these might apply to some of you. First of all, I always had somewhat loose fat and cellulite around my kind of hips and thighs, even though, again, I was very active and I was muscular in the legs, but there was sort of always something that didn't seem right. I have never been able to see my ankle bones in my life, and I always had what people would call cankles. So I just accepted it. That's who I was. That's what my body looked like. I'm kind of stocky and got big hands and big feet, even though I didn't get a lot of height. So I just thought that was part of it. I have always had lots of visible veins and spider veins, and later on varicose veins, but they were in unexpected places, like the front of my leg, my lower leg. And kind of like, who gets a spider vein right there in their 20s? It just didn't seem right, but I didn't know what to make of it. Very easy bruising. So this kind of speaks to the weak vein walls and all of those, the implications of everything with the vascular system. Constant bloody noses, horrendous menstrual cycle. Can anyone relate to that? There are a lot of people who've had hysterectomies very young within the Dercum's community. I have not, but I had an ablation actually, but fairly recently, I mean like 6 or 7 years ago. But that's just something, endometriosis tends to run with Dercum's. Constant swollen glands. At the first sign of a sniffle, my face blew up, the glands on the side of my face, the glands in my neck. And we always thought it was weird, but again, just seemed like, okay, that's what I have. Frequent severe headaches. A lot of Dercum's people complain of headaches, not necessarily diagnosed with migraines, but migraine-like headaches in terms of their intensity. And lastly, I have a condition called dermatographia. Has anyone ever heard that term? You have it? Interesting. So it was a neat party trick that what you could do is, like, if you scratch up your arm, it welts up. So you could write a word on your arm, and in a few minutes, it would be all welted up. And people were like, wow. And it would stay there for like 45 minutes. Well, recently, and I don't know that there's a correlation with Dercum's, but I'm mentioning this because in the Dercum's community, there's been a lot of talk lately about mast cell activation disorder. And if you read about dermatographia, it's mast cells and the activation of the mast cells. So anyway, I just thought I would mention it for that reason. I also always had a very high level of flexibility. So this kind of speaks to the whole Ehlers-Danlos thing. You can kind of see my knees are a little bit hyperextended. It's a little hard to see with jeans on, and I had flat feet, and I've had all kinds of problems with plantar fasciitis, and just a lot of ligament things going on throughout my life. And then I hit 40. So I went about my life just accepting all these things as normal. And then I hit 40. And everything, it's like someone flipped a light switch. Everything kind of blew up. I didn't know what was going on, but a million symptoms started finding their way to me. I mean, before 40, I probably went to the doctor once a year for a checkup, if that, maybe the occasional sinus infection or something, but no medical problems whatsoever, no medications. All of a sudden, my lower legs start changing shape, becoming kind of asymmetrical. The way I noticed it is my trouser socks didn't fit my left leg anymore. And I'm like who has tight socks in one leg? I mean, what is that? I had no idea that something was going on, but I was obviously suspicious. My thighs suddenly got bigger, they got jigglier. My belly went up and down in size on almost a daily basis. I remember driving to work and I'd kind of look down and say, is it a fat day or a skinny day? You know? My flat butt, I had always had a flat butt, and all of a sudden it started getting curvy. And I have to say, at first I really didn't mind. But it didn't stop. So now we have what we have to deal with. And I kind of started getting the shelf that is more characteristic of lipedema. Asymmetrical growths in the fat. I would notice little things. I'm like, I look at my belly, and it seems like the right side seems a little different than the left side. And everywhere I had a suspicion of something became a lipoma area. So it was really just the start of lipomas that weren't obvious enough yet. And then, it obviously became harder to find clothing. My size was changing all the time. Things weren't fitting the same way. My blouses didn't button down here. Can anyone relate to that? It fits you in the shoulders, doesn't fit you down here. So the pants, finding pants became harder. So this was all starting to happen. And of course, my answer was, I apparently am getting too fat. So again, I'm still on the blame train. Then there's a whole bunch of things that started making me go, something's going on. I don't know what it is. And I don't have time to go through every single one of these. But all the things that are associated with Dercum started appearing. I was getting this flushing. And I don't know, maybe right now, is my face red? Yeah, it just happens at will, but I can kind of feel that it's really hot. And it may or may not be accompanied by a low-grade fever. So just things like that were starting to happen. My legs, I remember looking down one day, and I'm like, they look blue or transparent or something. Like they didn't look like they used to look. And I could kind of make an excuse for every single thing. Oh, my grandmother had legs like that. Or, I could kind of excuse it away until it got to be so many things that I could no longer excuse it. So there's a couple of pages of these. Again, my body fat, without even changing size, it just changed type. Like it went from smooth to lumpy, but my weight didn't really change for a couple of years. And there were a couple of very specific lumps that I had checked out by doctors, and nobody seemed suspicious. Everyone said, oh, probably just fat. Probably just the way your body works, probably just grow fat in weird places. Nobody worried about it. And all these other, shortness of breath and night sweats. All of a sudden, I cannot touch alcohol. Within a minute of drinking something, I break out in a sweat, as if I have like that enzyme problem that certain ethnic groups have. But I used to be able to drink alcohol. I mean, I don't really even like it, but I could drink it. And extreme fatigue. I almost thought maybe I have narcolepsy. I could literally fall asleep in my desk chair, sitting up, without even knowing it, and wake up like an hour later. And, of course, then I would know it had happened. Or I could, I just needed to put my head on my desk at 4 o'clock. So it was like, wow, this all seems kind of crazy. Pain in my lower legs, a lot of muscle fatigue. Like I remember trying to paint the ceiling of one of my rooms one time, and I could not keep the roller over my head for more than a few seconds, and I had to bring my arm down and rest it, and then a little bit more. And I'm like, well, I've painted before, that wasn't a problem. So just a million little things. And the bottom one there, my bra band kept rolling up on this side. And I'm like, God, I've now defied the laws of physics. My bra doesn't even fit. What is going on? And I felt like there was something that was really ravaging my body. I mean, I used those exact terms to my mother. I said, I don't know, maybe it's cancer, but I know someday we're going to look back at this and we're going to say, aha, that was it. So and she just thought, I was a drama queen. So even though I didn't think I was a drama queen, but I wondered, do I have a hormone imbalance? Could that be part of it? Am I allergic to my new house, which was an older house, but it was relatively new to me? Could there be something in my environment that was causing me to feel tired all the time? Was I burnt out at work? Maybe I was just burnt out, and that was the symptom of all this exhaustion and everything else. So they all seemed rather random, but every new pharmaceutical commercial spoke exactly to me. I thought I had lupus, I thought I had restless leg syndrome, I clearly had chronic fatigue syndrome, and right around this time is when they really started advertising on TV. So I was self-diagnosing with something new every week. So then, this is all around 2002, this is when I was 40, the first bona fide lipoma comes along, and it was huge. I pride myself on being an overachiever, so I grew myself a nice half-pound lipoma. And yes, so what happened is right where that bra band was rolling up, that turned out to be a big lipoma. That lipoma had the dimensions of a soda can, or about a large chicken breast, if you want to think of it, because it had more tapered edges. So, I go to a surgeon, we get it taken out. He remarks how he's never seen anything like this in his life. And, in all the literature you might read about Dercums, they talk about subcutaneous, that all the lipomas are in that subcutaneous layer. This was sandwiched between the bone and the muscle on my rib cage. So it was deeper, and it was a bigger surgery because they had to get around muscle and move things around. So again, another thing where you say, what is going on? But we don't have any answers. The surgeon didn't seem that concerned. So I carry on. So with that scare over, I actually underwent 8 cycles of infertility treatment, including 4 cycles of IVF. Tons of hormones, right? This is an exact example of why, if we had more awareness, we would all be better off. Because the clues were there. If my reproductive endocrinologist, who knew all this history, could have put it together, I probably wouldn't have done it. Because I probably wouldn't have wanted to pass it on. It was very hard on my body. And it probably exacerbated the Dercums. I don't have proof of that. But it probably, made it come on faster. So had I known, I would have made a different decision. And at that time, I was also diagnosed with endometriosis. So again, something very common in the community. Okay, so continued on for a couple more years, symptoms getting more serious, until I finally just cried uncle. And I went to my doctor with knowing, because the other things, I was aware of them, but go to your doctor and say, I think my legs look a little blue, or I feel tired a lot. And there wasn't anything to latch onto that seemed like it added up to anything. But I, at that point, felt like I was going downhill fast, so I went to her. She sent me for a variety of scans and allergy tests and all kinds of things. And I remember the call where she said, oh, great news for you. You have a hemorrhagic ovarian cyst, which sounds bad, but she says that'll resolve itself. People get them all the time. They come and go. That's part of your pain. You have kidney stones. Those will probably pass. You may or may not know. So they were very, very little. We think you have irritable bowel syndrome because there's lots of gastric symptoms with Dercums. And the allergist showed that I had adult onset allergies. I did not have allergies as a kid, but I suddenly had very severe dust mite allergies, which kind of made sense with the house, and I have a cat, and the dust mites live in the fur of the animals. It's really the dead bodies of the dust mites, to be really disgusting. Then she had one more good piece of news for me. She said, guess what? The ultrasound cut part of your lung, and there's a nodule in there. So I'm like, the good news about this is what? And she said, oh, you know what? You live in the Midwest. There's tons of things. If everybody got their lungs scanned, they'd find tons of benign nodules in their lungs. You're young. You never smoked. I'm sure it's nothing. So the protocol, when that happens, is you use CAT scans every 6 months, watch it, and if it grows, then you take it out, regardless of what it is. So a year and a half later, mine started growing. So the doctors are like, we don't really care what it is. It's coming out. So I had a tumor removed from my lung. It's not a lung cancer, I'll tell you about it in a minute. And I had half my lung removed, which is, again, pretty major surgery. It's like 5 weeks out of work. So now I'm thinking, okay, well, we found it. We found what's ravaging my body. And it's a hormone-emitting tumor. It was a carcinoid tumor. And you heard Dr. Correa mention that earlier today, that she has had some patients with lymphedema or lipolymphedema, lipedema, that had that. So I don't know if it's connected, and has anyone else ever had one? I mean, I don't know that it's connected to Dercum's, but it seems really sad to think I have two very rare things. so I think maybe there's a connection, but I don't know the connection. But it is rare for the primary site of that tumor to be in the lung. They're usually in the gut. So that was another element of rarity that was kind of coming into play here. But at this point, I think, wow, well, we got it. I should start feeling better as soon as I've made my recovery. But it didn't work out that way. So in the next few years, all the symptoms just kept getting more and more exaggerated. Huge lipomas started developing. So I had the first one back in '02. In '07, I had 3 more removed because I didn't know that I had a disease. And I thought, well, this is kind of weird. My body grows weird things. And another half-pound lipoma removed from my knee and various other ones around my body. The year after that, they were everywhere, just completely everywhere, to the point where you couldn't possibly remove them all if you wanted to. Or at least you'd be in surgery a lot. So my weight started to fluctuate daily, like even 5 pounds a day. And that's probably, I bet some of you experienced that because of fluid. So I don't know if it was the fluid, I don't know, but I assume that that's what it was. I had persistent back pain because there's a lipoma right near my spine that kind of presses on things. Maybe it's wrapped around things. People who've had some removed say there are actually tentacles that kind of wrap around things. So they could either just be pressing on nerves or they could almost be strangling them. So I don't know in my case which it is, but it comes and goes. I'm fine now. In 6 months, it might hurt for another month, for a month, and then it will be fine for another year. So it sort of just comes and goes. I found myself lacking concentration, like almost becoming ADD. And I never had a diagnosis of that, but I felt like I couldn't concentrate on anything. And I couldn't sit for very long. So at work, I'm like walking the halls every 20 minutes, which is not very productive for trying to get things done, right? And because I can't feel like I can concentrate very well, like to take a big project and break it into pieces, I struggled more. I did the fast things, the easy things, because the bigger things seemed a little daunting. So I'm, starting to see my own limitations come into play here. My sleep was disrupted. I got noticeably dry eye and dry mouth. I used to wear contacts from sunup to sundown. Now it's a struggle for me to wear them more than a few hours. So, and I have been tested for Sjogren's syndrome, which a lot of people in the community have, and I don't have that. There's one lab out there that does a blood test, and I had it done, and they came back. It's kind of one of those, it's not definitive, it's more like not likely, not very likely that you have it. So, I mistook some of these symptoms for job burnout. So what did I do? I changed jobs. I had been at the same job for 12 years. I was sick of the problems. I didn't want to deal with the same problems anymore. Found myself a nice new job. And it just almost, escalated even more. Because the new job was 14 hours, no breaks, commuting 50 miles, just a horrendous situation. So ultimately, I chose to just leave corporate America and start my own business working for myself where I could control some of these things. But mind you, I still don't know I have a disorder yet. Okay, 2007, 2008. This is where the diagnosis comes into play. I mentioned I had 3 more lipomas removed before diagnosis. I turned to the internet, which is how many people diagnose themselves on the internet first, right? So I turned to the internet to figure out what's going on. I'm Googling multiple lipomas and every, permutation of those words that seemed relevant. And luckily, all my friends in college became doctors. So, so I'm sending them things. What do you think of this? What do you think of this? You think this makes sense? And they're sort of confirming or saying, no, that doesn't seem to fit. And I thought, I found these fat disorders. And I thought, that Dercum sounds horrendous, and I'm pretty sure I don't have that. It's probably FML. We're going to go with FML. Anyway, like I mentioned, Dr. Herbst was at the tail end of a study that she was doing at the time, and I found her name. I contacted her, and she's like, can you get yourself to San Diego? And I did. That's when it didn't take a year to this year. And within 2 minutes, literally 2 minutes, I think you felt my arm, and you go, yeah, you have something. And so I now have a diagnosis. I have validation, which is worth a ton. But now what? What am I going to do after this? There's no cure. I know that. There's no, really even treatments are kind of experimental or a little trial and error. So let me tell you what my life has been like in the last 8 years, just sort of trying to live with this. First of all, I followed all the dietary restrictions to the letter, except for the gluten-free part. I followed really closely for a long time. I didn't eat beef for 8 years. And it still progressed anyway. I can't say that all of the things I did, the supplements, didn't help. I can just tell you it didn't stop it. Hopefully it made it better for the last 8 years, and it might have been worse if I hadn't done those things, but it moves on. I've also developed very severe arthritis, osteoarthritis, which is another common thing you find, whether that's in a symptom or whether that's a separate disorder. Most people, I think with lipedema as well, have osteoarthritis. So, it seems to be a particularly vicious case of it that came on very quickly as well. And again, the allergies I mentioned. So basically, I wake up every day feeling like I have the flu. Does anyone feel like that? Anyone else? Yeah. I mean, everything is stiff. I'm achy. I'm congested because of the allergies, most likely, or because my lymphatic system is sort of sluggish or something like that. People always try to come up with an analogy for what does the pain feel like. I will tell you, I'm probably not the best person to ask about that because I don't think I have as much all-over pain as some people with Dercums. But my lipomas hurt if they're touched, if they're squeezed, if I'm sitting in a chair with legs that are just at the right place, or I'm sitting on them. So they've been described as bee stings. I feel like my lower legs are almost feeling like they're being dipped in boiling water. They just sort of burn. Sometimes they feel a little numb. But do you know what binder clips are? Those black clips? Imagine putting like 30 of them on your body. That's kind of what I think the lipomas feel like. If they're, in my case, if they're touched, if they're squeezed. They don't feel like that when I'm standing right here. But I'm starting to get some nerve pain going down my leg. So it's probably some compression of the nerve starting to happen. The lipomas continue to get bigger and more of them show up. My muscles pulse and seize randomly throughout my body. And so there's been a lot of like muscle seizure types of things. My calves are always tight no matter how much I stretch them. Out of nowhere, my butt cheeks will just start pulsing. I mean, I don't know that anyone else can see it, but it's a weird feeling. and it goes on for a while, sometimes days at a time. As I mentioned, the lipomas are painful if touched. And I never feel well rested no matter how much sleep I get. I see, different doctor shows and whatnot, and they're like, oh, everyone needs this much sleep. I can get 12 hours of sleep. I don't feel well rested. And right now I'm in a phase where my body says, we're going to give you 6 hours, and then we're going to wake up. So then that leaves me needing a nap in the middle of the day to get my other 1 or 2 or 3 hours to make up for it. And I go through cycles like that. Then I'll go through a cycle where I can sleep for 12 hours. I'm never really sure on any given day what I can do, how much pain I'm going to be in. So I have to be very flexible. These flare-ups come and go without warning. And again, it feels like a light switch. It's like, who decided today was the day? So I'm still learning my new limits. My brain hasn't really caught up with my abilities or my declining abilities. So I'm constantly overestimating what I'm going to be able to do. I make lists with like 10 things and I get 1 done. Right? You can relate. I see a lot of heads nodding. And I'm happy with myself that I got that 1 done. So my standards have really sunk. I underestimate how much time it's going to take. I try to be better at that, but I chronically underestimate how much time. I've learned that every action has a reaction. If I walk today, probably not walking too well tomorrow. So everything needs more rest than in the past would have been the case. And I'm also still trying to figure out how to dress my ever-changing body, how to hide the worst areas with styles that probably wouldn't be what I would pick if I could pick anything, but it's what I pick with Dercums. I'm getting more comfortable living with less certainty because I don't really know with any one symptom. Is it Dercums? Is it lipedema? Is it arthritis? Is it menopause? Or am I just getting old and does everybody who's getting old feel this way? Or is it something new? And I don't want to miss something new because we're not immune to new diseases either. I mean, nobody said if you get Dercums, good for you, you don't get anything else. So you have to work with that. So what I do is you heard a lot of talk today about controlling the inflammation, the lymph fluid, and the pain. So I do all of those things, and my exercise of choice is swimming. It's an exercise in bravery to go to a public pool. But you know what I decided? They're not looking at me. And even if they are, what are they going to do with that information? Like, you know, they're not going to like post it on Facebook or something and say, I saw this girl at the pool today, blah, blah, blah. So I just got over it. You know what? Old lady, fat, ugly legs, deal with it. And so I'm not a good swimmer either, so it's like a bad picture all around, but I keep trying, and as long as I'm moving my limbs underwater, that's okay by me. I try to stay as active as possible mentally and physically. This is kind of for my own sanity. First of all, I think it's a slippery slope. If you start not being active, you start, you know, being less able to be active. So I really try hard to keep being active, but it also is a distraction. If I'm working, I'm not thinking about how much pain I'm in, you know, and I'm not thinking about my Dercums. I'm not wallowing in it. I'm not hanging out on the Facebook, you know, boards all day long. I go to them, though, because I want to be active in the community, and I want to also learn from other people's experiences and share my own experiences. But you have to kind of filter what you hear on those boards. There's a lot of drama. There's a lot of panic every time somebody in the group passes away. And I get that that's scary, but then they start attributing it to Dercums, and we don't know that to be the case. So there's a lot of that as well. I seek medical help when I have atypical symptoms or asymmetrical symptoms. So if everybody in the community is complaining about it, it's probably Dercums. If nobody's complaining about it, I better get to the doctor. And then I fantasize about having imaginary surgeries and how many minimal number of cuts to get maximum number of lipomas out of my body. But I haven't had any more surgeries to remove lipomas since those ones in 2007 before I knew I had Dercums. And again, there's a few I'd like to take out, but all those areas have grown up with new lipomas. So I'm starting to outsource what I can't do at home, which is really hard for me. I'm a DIY kind of person, but I can't mow my lawn anymore. I can't even clean my house well anymore. I talk openly about the disorder with my friends, and I feel like initially I maybe just tried to pretend everything's okay, everything's normal, and now I let them know how I really feel. And they're really kind, and they listen, and then they say, oh, you should try to lose some weight. I bet you'd feel better. So I know that there's still an uphill battle. So I'm also grateful for what I don't have. I don't have a lot of the comorbidities. Right now I have hypertension. I have possible Ehlers-Danlos, maybe MCAS, but I've not been tested, so I can't say. I can just say that a lot of the symptoms for mast cells seem to be things I have. Osteoarthritis, and it's been 10 years since my lung surgery, no recurrence, and I've been given a clearance. I don't have to monitor it anymore. So, yay. And thank you. And I have to go quickly because I'm over time. I found doctors who listen to me even if they don't understand the disorder. So they're learning from me, but they're kind about it. They're not, they don't dismiss my concerns, mostly. I've had a few. I'm grateful for the symptoms I don't have. I don't have depression. I don't have brain fog. I'm not on narcotics. I'm not disabled yet. Childhood trauma, I put that in there because a lot of people in the Dercums community believe that it was brought on by childhood trauma, and that they had a certain incident, like a sexual assault or something like that. I have not had any childhood traumas, other than growing up in a multifamily dwelling with a lot of people around in the middle of the city. That's the only trauma I had. So, and I have no clear family history. I think my mother has it, but I'm not sure, and there's some things on my father's side that seem suspicious, but I'm not sure. So we don't know. And I can't live in fear of the unknown, so I just keep working hard, put my energy against what's most important, plan for the future, even though you can't really plan for uncertainty. And there are only 3 things I fear. If it turns out to be true that I'll die early from Dercums, I can accept that, but it better be after age 67 and a half, which is the first year that I can collect Social Security, because I want some of my money back. I live in fear of having to reveal my weight to anyone, including even the doctors. But I had 2 appointments in a row a couple of weeks ago. They couldn't accommodate me on the same day, so I went back 2 days. And they insisted on weighing me the second day. I'm like, seriously, you have an up-to-date weight. And it just, you know, makes me mad. So just to toy with them, I actually weighed 3 pounds less the second day. So, and I also fear any social event involving a bathing suit. So if you put a pool in, please don't invite me to your pool party. So, and lastly, a final thought. This is an inspirational thought. It was not about Dercums, but it really makes me think of Dercums. Some days are better, some days are worse. Look for the blessing instead of the curse. Be positive, stay strong, and get enough rest. You can't do it all, but you can do your best. So thank you.